Now with what you need to know about perimenopause, ABC News Chief Medical Correspondent Dr. Tara Narula is here to break this down for us. We've had a very active, lively conversation. So let's start with what's the difference between perimenopause and menopause, and how do you know where you are in the scheme of it all?
Well, let me just say I'm really glad we're talking about this, because there was a time when I was told we cannot talk about menopause on television, and menopause is having a moment now. So to differentiate, menopause is when you have not had a period for a year. That is a time where the ovaries stop producing eggs, you stop producing estrogen. The years before that, usually on average about 4 years, starting around the age of 47, is considered perimenopause. It is different for every woman. It lasts for a different amount of years, and that is the time where women may experience several things. So irregular periods would be one of them. So the periods come sooner, later, you skip a period, you have these very fluctuating hormone levels, in particular estrogen. And then there's over 30 symptoms that women can experience. So the hot flashes, the night sweats, memory changes, mood changes, sleep changes, joint changes. So the whole system, wherever there are receptors in the body, you may experience some symptoms during perimenopause. And then we also see changes like bone loss and even elevated cholesterol levels. I see a lot of women coming to me saying, my cholesterol was fine, what's going on? Why are my levels going up now? So lots of things happening in perimenopause.
Well, and as you're thinking about managing these side effects, should you be taking hormones?
That is a big question. So first of all, let me say there's also something called the Menopause Society that has certified menopause physicians who you can see and will be educated on this topic. So that's a great resource for women. But hormones come up a lot, and there are certain women where we say it's generally considered okay. Those are women who are within 10 years of menopause, under the age of 60, without contraindications, who are having symptoms. The hormones really work best for those vasomotor night sweat symptoms. They can help with some other things. Who are the women that should not take it, right? This is the really important thing. So women who have coronary heart disease or cardiovascular disease or at high risk, have had a stroke or heart attack, women with a history of breast cancer, clotting disorders, or active liver disease. Now the hormones come in lots of different forms, pills, creams, gels. Lots of times women will be prescribed estrogen with progesterone if they still have their uterus, or just estrogen alone if they don't. Important though, I think a lot of women think that they should be taking it proactively for prevention, but we do not recommend it right now for prevention, but really more for the treatment of those symptoms.
So what about non-hormonal options?
Great question. So there are some women, as I mentioned, who are not candidates for the hormones. And so for them, we do have things like antidepressants. There are certain ones, one actually that's FDA indicated for this reason, among others. Also a new drug that was just approved in 2023 called Veoza that can be used. There is an anti-seizure medicine, an overactive bladder medicine, and then things like cognitive behavioral therapy, exercise, stress management, all of that.
Dr. Narula, glad to have you and glad we're having this conversation
yes,
now.
me
Finally.
too.
All right.